Today we'll be going over um, diagnostic testing, and let's get started. Diagnostic tests or procedures are mostly um, procedures to diagnose whether a person has pathological or non pathological medical conditions, which means um, basically, in plain, to make it plainly, to find out what's going on inside of the human body and give us a sense of understanding to the patient and to the doctor. The first test that we'll be talking about is a bronchoscopy. A bronchoscopy is basically a procedure that gives the doctor visualization of the respiratory system down the trachea, um, past the larynx, and the bronchi, and it could be done with a flexible fiber optic scope or a rigid scope. And what it's doing is there's a camera that goes down just to look see for foreign bodies, whether there's like cysts or um, something that needs to be removed or airways to be cleaned. If you have a continuous cough or something just shortness of breath and you can't get it by the pulse ox, you can't get it by outside of the body or examining outside the body, we need to go in and get a visual look inside the lungs and see what is actually going on. During this procedure, you will be sprayed with lidocaine down your throat area and nose area, and that's so that you won't feel that scope going down. Also, you will be in like a conscious sedation, so that means you won't be conscious, don't be afraid, won't be conscious during the procedure, but you will be in kind of like a twilight sleep. And it's so that you're okay during that time, that they know that you're okay during that time, and that the doctor, that you're still enough to where they can look into the lungs. Before this procedure, there will be all eating and drinking will be cut off at midnight. There will have to hold some of the medications, especially the ones that induce bleeding, or like your blood thinners, aspirin, any type of bleeding complications. We don't want those medications, but actually definitely talk to the doctor a week in advance before getting this procedure, knowing what medications you may need to stop. Um, After the procedure is done, it could take 35 to 45 minutes. And after the procedure is done, we want to make sure that gag reflex is back before you do any eating or drinking, because you will aspirate or choke when you don't have that sensation to feel um, when it's going down your throat. You should be able to resume activity, but after anesthesia, I know for myself, having to have a biopsy, it's um, when you're under anesthetic, you're kind of dazed for like a day. I think I slept for, I think my dad said about 10 hours. And even then, it felt like my body was like heavy, like I had to pick myself up. So you don't want to make any type of major decisions or do any driving during that time. And here's an image of a bronchoscopy being performed. There's the bronchoscope going down the trachea, down into the bronchi, and it's the patient laying in a supine position, and the doctor getting good visualization with the scope and viewing what's going on down there. A barium enema, that's another diagnostic procedure. It's basically an x-ray of the lower GI, but as they do so, they insert an enema into the rectum just to get better visualization of what's going on in that problem. Now, you could be suffering from abdominal pain for a long time, and that's what could have warranted that type of testing. If the doctor palpated and felt um, there was something going on. But what would happen is, up until the exam, we suggest people be on a clear liquid diet, not eating anything heavy, nothing with a lot of creams in it, maybe some sherbet, broth, soup, not with noodles or anything, coffee, tea. But what we really want to do is get that colon, which is that lower GI, the large intestine, we want to get that cleared out. So the doctor may suggest laxatives or enemas, over-the-counter enemas, just to get that colon cleaned out. While receiving the barium enema, a X-ray machine will be over you, and it will be taking pictures of that lower GI as the barium liquid is going or inserted into the rectum. The doctor will have better visualization during that x-ray and can be able to pinpoint what exactly is causing some abdominal discomfort or pain. And here do we have a radiological film right here. Here's the large intestine, and here's the rectum, and this is where the enema is inserted. And this is how the patient will be laying on the side with the enema, and there's the barium liquid inside of and there's the x-ray machine. After this, you may want to have the urge to expel a bowel movement quickly, and the bowel movements may come out white. It's not to alarm you. That's just the liquid coming out and flushing out. Now, if you experience some type of constipation, because the barium liquid is kind of chalky from what I remember. I don't know if they've got new liquids, but I just remember being very chalky, and I remember patients do complain about it constipating them. But what was always the suggestion, and I'm not the doctor, but my suggestion was always to drink more fluids. I know for me, myself, it's hard to drink water, but just apple juice, water, something that will keep you moving and keep that area flushed, or keep your body from holding on to that barium fluid. And the last thing that we'll be talking about is a liver biopsy, which is a procedure that is done by removing a small sample of tissue from the liver to be tested in the lab, just to find any type of findings. And that is a picture of a percutaneous, but we're going to go back to the previous slide. All right. There are 3 different types of liver biopsies. There's the transjugular, the percutaneous, and there's the laparoscopic. The laparoscopic is more surgical, where small incisions are cut. They use a trocar, which is surgical tools, to be inserted in those multiple incision spots. And one of them, to gain visualization, there will be a camera. They'll go in, find the liver, clip a portion or sample tissue off, and then remove the tools, sew the incisions back up, and you'll be all set. It will not be so invasive to where it cuts into you. There's just small incisions. The other one, that's transjugular, you'll be laying down. They numb the area that they're going into your neck, and there's a catheter that is kind of going down to the liver that they can go in and take some liver tissue. I was going to say fluid, sorry. But what we're focusing on today is the percutaneous one. This biopsy is where you lay on your back, supine position, um, and what they do is give you a local anesthetic. They'll put it on the right side. The doctor mainly does a few taps or get an ultrasound to get a better visualization of where he's going. And what they do is insert a needle that reaches your the liver. And the first question that we hear is it going to hurt? You're going to feel a lot of pressure. More of the soreness will come afterwards. What you will be is with a mild sedative, something that will keep you calm, keep you from moving during the procedure. Once the procedure, I think the biggest part is the anxiousness up until the procedure, but during the procedure takes seconds because the needle's going in and out and it's pulling out tissue. Once that's done, they might put some strips there, but it's a small incision, so they'll put some stitches or strips, just depending. And then the biggest thing is probably the tape from the dressing. That's about it. That's the biggest thing that you'll feel. But it's a very fast, very quick. I think it's just the leading up to it, the not being able to eat 6 to 8 hours, the buildup of, oh my gosh, biopsy, that word mainly scares a lot of patients. And I know for myself, it scared me. I had to have a biopsy of my uterus, and a doctor wanted to do it in the office, in the exam room, and clamp down on my cervix. And I said, well, this is not going to work. So then we had to go to Akron City Hospital, where I was under anesthesia, and he did a D&C and a biopsy, and I was all set. There was a lot of soreness, but mainly it was the feeling of nausea after the anesthesia. So after these procedures, you always want to make sure you have someone available. And here is a visual of a percutaneous liver biopsy. The person is laying back, hands up. They're still awake. They're not under anesthetic. They've been given a sedative to calm them so that they're still enough for the doctor to go in. There is the syringe. The needle is going in on the right side of the body. Minimal blood, minimal bleeding, and I think it just depends on how you bleed or if there's any bleeding at all. That's the other thing, is stopping the medicine such as Coumadin, heparin, any type of anticoagulant or blood thinners. You want to stop those before getting a procedure like this. And lastly, just some things to remember. Always ask about your procedures. Don't feel like you're asking dumb questions, stupid questions. All questions that you feel that you need answered before a procedure, ask. You are your biggest advocate. Also, be aware of what medications that you're on at the time of the procedure. Usually a week before a procedure, you want to talk to the doctor, make sure that it's okay to take your meds. But if they want you to be NPO, which means nothing by mouth after 12, sometimes that's hard when you have to have medications with foods. So that's why some providers or doctors may put a hold to medications. Also, have someone with you or an advocate to stay if home alone. Um, Advocate for yourself to stay, if even for a couple of hours in recovery. Um, I know a couple of patients that I know had no one at home and had no one to go to, didn't have the support, didn't have family, didn't have kids, didn't have a cousin or aunt or anybody to be with them. So I just remember being a STNA and hearing a patient advocate, like, what am I supposed to do? You're just going to send me home after this procedure? And finally, one of the nurses spoke up and said, hey, I believe there's a recovery room that she can stay in, just for a couple of hours after the procedure. And the hospital even gave her a cab voucher afterwards to help her go home because she had taken the bus to the procedure. So don't be afraid to advocate for yourself. That's my biggest thing. And that's it. Thank you very much.